As we head into the holidays, the Louisiana Department of Health wants people to be aware of a rise in flu cases. Louisiana has seen double the national average of flu cases, and cases have actually tripled across the state in just the last 2 weeks. Our public health director, Dr. Martha White, explains why that is and what people need to know. Doctors typically expect the flu to start slowly rising this time of year, peaking in November, then spiking in January before it drops back down. But in Louisiana, the influenza spike is much earlier than usual.
It's a little alarming that we're seeing such a rapid rise. And we're seeing it a little bit early.
There's been 5 children die from the flu in the United States and 1 in Louisiana, as the state has doubled the national average of cases.
We don't want to see our little people and our elderly and our people who are high risk, passing away from something that we can prevent.
It's on track to be a worse flu season because other parts of the world are having a more significant flu season.
Unfortunately, it looks like we're following in those footsteps.
Compared to last year, when there was hardly any flu cases. What's different is how COVID changed our practices.
We think it has something to do with the way COVID changed our behavior and then changed the virus's behavior.
Viruses like the flu and RSV are adapting and changing their infection seasons based on our social schedules and better hygiene awareness.
It likes to try to change itself up a little bit and find ways to be more effective at making more people sick.
The best tool remains the flu vaccine, despite what Dr. White referred to as a COVID-weary and wary world.
And so I think we just need to remind people to take a deep breath and remember these vaccines have been around for decades. They're very safe.
She wants the community to just be aware of what doctors are seeing.
Before they decide to go visit for Thanksgiving, if they're not feeling well, maybe consider not going or having someone bring them a plate, or maybe if they're just starting to feel poorly, maybe they want to just wear a mask and maybe distance a little bit to try to protect their family members. And Dr. White says hospitals are okay right now, but it's doctors' offices and urgent cares that are busy with flu patients. But hospitals are facing staffing shortages, especially with nurses, so they do not want these cases to spill over into hospitals. Each year, between 22 and 30,000 people die from the flu, so it's important to limit that number as best as possible, especially for those with underlying diseases such as heart disease and diabetes, which are especially high in Louisiana.